Anything else? Cool. All right, let's talk about some early pediatric care. And you can flip over. All of these things have all the notes from the PowerPoint presentation and everything I'm speaking about, so you guys don't have to feverishly write anything down, but you're certainly welcome to write other things that I don't mention in the notes. But basically, the early pediatric care, there are medical interventions in the hospital. Baby's born, baby comes up to mom's chest, baby gets dried off, and then the medicine starts. You can delay that a bit, but they have to do it within 2 hours of birth. And the things that happen to baby in the hospital are they get a heel stick for a glucose test and a metabolic test. The things they're testing for metabolics are in this handout. There's like 20 things that they test for in Texas, so you can see what that's about. Then they also get a vitamin K shot. And vitamin K, if baby has a vitamin K deficiency, then they are not able to clot blood as effectively and could bleed out if they have any type of abrasion. So it's 1 in 10,000 babies it affects them, but they're giving a vitamin K shot because you just don't know if your baby happens to be one of the 10,000 that might be effective. So it's preventative for all babies. They put on erythromycin eye ointment. And that prevents infection from gonorrhea and chlamydia bacteria. And again, they do that to every baby, regardless of the status of your STDs, just because a lot of people don't disclose or don't know or may not, the hospital doesn't question if you have, a fidelity in your relationship. They just treat everybody. So they also give a hepatitis B shot. And that's the first round, that's the very first vaccination your baby will get if you are following the American Academy of Pediatrics vaccination guidelines. There's also, that's in your handout here, recommended immunization schedule. And it talks about all the vaccines that are recommended. And you also have choice in this. If you decide you would like to delay and go on a slower vaccination schedule, that's fine. And at the hospital, you would have to sign a waiver requesting to do the hepatitis shot with your pediatrician's office. If you're okay to vaccinate away, then they would just do that as standard medical care. Does anybody have any questions about that? And if you have already locked down a pediatrician, your pediatrician will round at the hospital, assuming they have privileges at the hospital you're delivering at. So your pediatrician will visit your baby usually on day 2 and also on day 3. They'll visit baby on day 2 just to give the baby a physical exam, and then on day 3 they'll visit again and test for jaundice. Jaundice doesn't usually show up until a few days in, and if everything looks good, then your pediatrician actually discharges you. It's the pediatrician who has the say on when you can go home, not necessarily the obstetrician. If your pediatrician doesn't have privileges at the hospital you deliver at, you would get the internist pediatrician, the one that's on call. But they'll do your best to call your pediatrician to come. So that goes into the pediatric well-check schedule. So birth, they're going to come at the hospital. If they don't, your pediatrician will want to see you on day 4. So you get discharged from the hospital in most cases on day 3. So the next day, you're right back to the pediatrician's office. And there it is just a physical exam for baby and a lactation assessment. So they're going to see how the latch looks, how baby's tongue looks, if your milk has come in, helping you with engorgement, that kind of thing. 2 weeks, you get the second metabolic screen, so another heel stick. And they are again looking for the same things, but now that baby has been eating, baby's metabolizing things differently, so they want to just recheck on some of those things. And they get their second, at 2 months, is their second routine vaccination. So hepatitis B, the second shot of Hep B comes at 2 months. And a bunch of other ones. Does anybody have any questions about that? That's early pediatric care. Of course, it keeps going on, and there's a schedule, and your pediatrician will fill you in. But this class itself is covering the first 8 weeks. So that's the first 8 weeks of pediatric care. there's a true and false quiz about circumcision, and you guys can take a minute and test your knowledge